Hello and welcome to this edition of Bayou Time. I'm your host, Keith Weissite, licensed clinical social worker with Terra One Home Care. And we thank you so much for joining us, however you may be joining us, especially when it comes to talking about programs that we identify a need, we do something about it, and we get to a point where we see that the program is working. I welcome in all the people that do the work with the Family Preservation Court, starting Judge David Arsenault. Judge, welcome to the program.
Glad to be here.
We appreciate it. Sitting next to him, Ellen Dosky. Ellen, thanks for joining us.
Thank you for having us.
All right. Sitting next to her, Miss Valerie Cooper. Thanks for being here, Valerie.
Hi, Keith. Thanks so much for having us.
We're glad to. And I got to tell you, Judge, it's exciting to see programs where we identify a need, we implement a program, and it's working.
And it is, Keith. About a little over a year ago, we established a specialty court in Terrebonne Parish with help from the Louisiana Supreme Court. And the court is designed to address the problem of parents with substance use problems or issues who have children in state's custody. And our goal is to help these parents recover so that the children can return home in a safe environment and permanently. Our goal is to solve the problem on a long-term basis, and we're excited about what we've been able to accomplish in the last year doing that.
Well, and I know there's a partnership through the DA's office and as assistant DA, really important with your role in how that happens, Ellen.
Yes, so the DA's office represents the department in all of the foster care cases that go before the judges.
Right.
And there was identified a need that there was need for intensive treatment for substance abuse issues of parents who have children in state's custody. And so that's why we partnered with the judge as well as the department and several other partners, who you'll meet later,
Right.
that developed this program. And it is an intensive treatment program for the participants, and they have to meet with the judge twice a month. And we staff the case twice a month to see their progress. And so it adds another layer of accountability to the parents. So instead of just sending them off saying, you need to fix this problem, we help them fix the problem. And we've been very successful at educating the general community with all the stakeholders that are within the program about the need and the understanding of substance use disorder and how best to treat it and what's the best practices to treat it. And that's what we try to base our program on, is all the best practices to treat it for the long term and not just for the short term.
And the way to determine best practices is to see who's graduating, right? Val, tell us a little bit about this inaugural graduating class.
It was wonderful, Keith. May 13th, we were able to reunite two different families with their children, and one a male and a female. And both of them had completed the requirements for graduation. We had a get-together, a family day, where all the children and all the participants could come, and we celebrated a success. You know, treatment is a long-term process.
Right.
It's not something that you just jump into and, okay, now they're fixed. It's a lifelong illness.
Right.
And with relapses and with successes. And for graduation, we were able to experience and participate with the clients with the successes of what their hard work had been.
Yeah, and because it takes so long to do that, it's wonderful to be able to see the support, because that's the big thing. Providing that support, identifying the problem, having a program to address it, and then, like we talked about, maybe talking to some of those partners a little bit about how we go about providing that. We get two graduations, and for two families to come back together, and we say that in retreat work all the time, that if you reach one person, you've really done your job. Y'all brought two families together.
Absolutely.
That's got to feel good.
It's a wonderful feeling. We have about 14 participants in the program now after the graduation. The Supreme Court allows us 15 slots.
Okay.
And the Supreme Court provides the funding that we use to provide the services to
Right.
help these people who have this problem. And meeting with the judge regularly, following up on what's going on in their lives, holding them accountable for their own recovery. It's been very satisfying to me as a judge. I deal with a lot of people who have substance use problems in a lot of different contexts,
Right.
including parents with children in state's custody. And I can't tell you how rewarding it is to see something good happen when people are given the assistance that makes the difference in their lives and their children's lives.
Right. And the future of their kids. Right. So speaking of the future, Ellen, tell us a little bit about where the program is heading.
So we are hoping that we'll be able to expand to about 20 slots, and so we're asking for
wow.
approval from the Supreme Court to get that expansion. One of our other issues is that we're working on is trying to establish more trauma-based therapy for both the participants and for their children, because we know that removing a child from their parent, no matter the circumstances, causes trauma to the child. And that's only the first trauma. We do know that if the child is older, they will probably likely have other trauma incidences in their lifetime.
Right.
So we're working with some partners to implement more trauma-based therapy for the participants and for the children. And I just want to also add that, we had 2 graduates, but we all agree that there's at least 5 others that we've reunited. They just didn't finish all of the program.
Right.
And we do have high standards, and we wanted to maintain those high standards. So although they didn't graduate from the program, those 5 people were able to be reunited with their children and in a sober household. So although they didn't complete it, they were sober and they were reunited with their children. And I believe that that needs to be counted and recognized as well, because that does mean something, and that is the mission of the program.
Well, it's a wonderful program. We appreciate it very much. We're going to take a quick break. When we come back, we'll have some new faces up here talking about the value of that. Judge, we appreciate your time today.
My pleasure.
All right. Can't have good programs without partnering with people to make you better. Welcome back to the program, Ellen Doskey. Ellen, one of those things about programming is doing different roles and being able to establish those roles with different people who you can partner with, right?
That's right. This is a collaborative team, and we are focused on making it a team effort at every staffing. And so we have partnered with not only the Department of Children and Family Services, who I represent. There's a caseworker at every of our staffings, but we've also partnered with CASA, as well as the parents' attorneys and the children's attorneys, and in addition to our providers. But those are very key partners that help us, and each person has a different role to play and a different person to advocate on behalf of. So it's very important to hear all sides during staffing.
Right. Those staffings are really important. And so Christine O'Quinn, Director of CASA of Terrebonne, tell us a little bit about your role and how nice it is to be part of a program like this.
Yes, thanks for having us all. So CASA is specifically advocating for the child, so the volunteers are welcome. In fact, Val is very welcoming to anybody that wants to participate in these staffings and all. And so our supervisors, along with the volunteers, are able to go. And the main thing, our role is we are advocating for the best interest of the child, and part of that advocacy involves are the parents doing what needs to be done in order for that placement, that reunification to occur in a safe setting. And so the volunteers are able to monitor the progress, like Ellen said in the last segment. They staff them, they make sure the progress, what those steps that are needed to be taken are taken or not. And so the volunteer is able to determine from there and make recommendations to the judge on the placement. Do they feel like that they're making that progress in order to recommend reunification?
And there's so many different levels. I mentioned it earlier about trauma that takes place. And it's really good for CASA to be able to give that perspective in those staffings about how that child is really doing.
Yeah.
Right?
Yeah.
Because y'all have that contact representing what the child needs. And working with them closely is really what gives us the opportunity to see that.
Yeah. And always to be mindful of, because they are focused on the whole family, but that parent getting better, but also the child's time that they've been in care. And so just having that perspective of moving forward with the case and those type of things.
And making sure everybody's ready, right?
Exactly.
Making sure that the unification is the right time. Timing seems to be so very important when it comes to this program. And I love that there's so many pieces coming together with staffing to discuss that. We're going to talk about it, and it's often, which is good, along with the other sides of treatment and those kinds of things as well. And so, let's talk a little bit about your role, because you're coming from that parent standpoint, right?
Correct. I am I'm an attorney for the parents with the Office of the Public Defender. So I kind of help the parents understand their legal rights and guide them through the child in need of care process. So I'm there with them in court, but I also attend all the staffings. So if they have any issues that maybe they didn't want to talk to DCFS about, or they didn't feel comfortable, they bring it to me, and then I can bring it to the group and say, look, this is something that's going on. This is something that needs to be addressed, and it'll help them work their case plan, and we can come up with a solution together as a team.
And so, what a really good point, because very often substance use disorder or people who are having addiction issues, very often it's not just one particular area. So very often that it means so many different things. And none of us like to say, oh, by the way, there's something else I need to say that I'm not doing so well at. It's great that y'all can come from those different perspectives, but have an interdisciplinary team approach to all talk about where are we? Where are the parents coming from? Where are the kids coming from? What's our legal responsibilities, right?
Right.
What is the judge saying about, what? They need to do more, get more in this area. And are they being accountable to that? And so it's really good to be able to have that. It's like you're a resource while we're holding them accountable all at the same time, right?
Right. And we meet so often, every 2 weeks, so we address everything as soon as it comes up. So when they have an issue, if it's housing, if it's trying to find a program, if it's any kind of issue that they have, we can address it right then. We don't have to wait the months in between the legal system.
Right.
Because the child in need of care process, it's a lengthy process. It's a year-long process of hearings. So we may not be able to address those issues, or we're going to address them at the last minute. Well, every 2 weeks we meet, so we know what's going on with these participants.
Wow. And again, that echoes the importance of having 15 people right now and saying we're prepared for 20, because we know in our area there's a need for it. Right, Ellen?
Oh, there's a definite need for it. We've seen a significant increase in drug-exposed newborns, and we do try to help anyone who is interested in treatment. They're welcome to come into our program if they have a drug-exposed newborn. But the important part of it is the collaboration. It's not an adversarial system. Most court systems are adversarial, but this is different. It's a collaborative team effort. We all are working towards the same goal of reunifying the family. And although we all have different roles and advocate for different positions, it is a collaborative team effort. And we most often come to a solution that is beneficial to everyone. And sometimes it's a compromise, and sometimes it's a transition plan. Before we place the children back into the home, we might do it on a slower basis, but we all come together to make that decision.
Collaborative is the key word. Partnering is the best way to do it. Spending some time talking about Family Preservation Court and all of the different pieces. One of the very important pieces, and I will tell you, all of the people that have come on to this point have talked about the value of partnering with getting good treatment. Not just good treatment, but in their words, great treatment. We welcome into some of the people providing that treatment. Dr. Andrew Williams, welcome to the program. Glad you're here. We appreciate it. Sitting next to him, Sarah Hensley. Sarah, thank you for joining us. We appreciate it. And my longtime friend and colleague, Gilbert Washington. Gilbert, thanks for being here.
Thanks for having us.
All right. And so, Sarah, let's start with you. Let's talk a little bit about how this process starts from your end, from the treatment side.
Sure. So very often, we are the first stop for the identified family preservation client. We work to stabilize them medically, emotionally, regulate behavior. Very often they're at risk due to their impulsive decisions, impulsive actions in the public. So our goal is to help them regulate and to prevent them from harming themselves and others. So we help with the medical detox side. Very, very frequently, that's a huge fear.
Sure.
Due to Dr. Williams' work with addictions, we're able to specially focus on some of their needs to help that. Also, we provide emotional support and redirection and de-escalation. It's a very acute phase. We can hold them up to 15 days, and we use that time to start initiating those first thoughts on recovery, what it's going to take. And the unique thing about family preservation is we always try to find leverage. What is the person working for? Well, we've got it there. It's their child. So very frequently we use that. We redirect them back to that behavior until they're able to believe in themselves again. And that to me is a key focus and why this program is so strong and it's working so well.
Well, and working well means you've got a specialist who understands all the different aspects, all the different sides. And so being an addictionologist and being a psychiatrist, it helps being able to manage those behaviors, right?
Definitely. I've had the privilege of being trained in child, adolescent, adult addiction medicine and addiction psychiatry and working closely with the whole spectrum of patients. And so it's been a pleasure to work with a population that has a goal of reunification with their families and to really leverage that for sobriety, which is life-saving.
And you have a tendency of being able to keep them a little bit longer. Because I got to tell you, historically, we're seeing where people are leaving or having to leave facilities sooner. You're finding a way to be able to get them the treatment that they need for maybe a longer period of time, and you are able to recognize when they're ready.
Well, we certainly work hard and co-partnering with the people on this panel and the family preservation. We have definitely worked to create a different type of milieu therapy where we highly focus on education. Both myself and my nurse practitioner do hours a day of education on the disease of addiction and really trying to bring the quality of education that really they wouldn't find anywhere else unless they went to a specialty unit. And they deserve that. A lot of these patients are marginalized, have very limited access to quality care, and they deserve that.
Well, listen, I got to tell you, as a social worker in this community for 30 years, it is so exciting to be able to see really an investment in educating and helping them to change those behaviors, especially with you guys being the starting point, really helping them to realize that I can stop this behavior and that I have a goal, and then turning things over back to them and providing that outpatient care, right? And hopefully not coming back to see you, right?
Absolutely.
And the way you do that is with good discharge planning. So Gilbert, let's talk a little bit about how that process I know we say discharge planner like you're at the end of the process, but we all know discharge planning starts as soon as they get there. Let's talk a little bit about that process for you.
So as soon as the patient arrives, our team of social workers and counselors meet with them, they assess them, and after that, they let me know what some of the needs are, and along with meeting with our disciplinary team, multidisciplinary team, at least every 7 days. We meet with them twice a week, actually, with our patients, and from that point on, we figure out together as a team what the needs are, whether they would best be suited in a residential program, which we push very strongly because we believe in the disease concept, which is very much taught by Dr. Williams. And so since we believe in the disease concept, my perspective is this, that if I had a patient or a family member who had cancer, for example, and they would say to me, that family member needs to go to treatment every day. They need to go through chemotherapy.
Right.
And I would say, let's do that. Let's do the best thing possible for my family member. And that's what we do. We understand that while they are treated for cancer, that's a part of the treatment. Discharging them right to home may not be the best thing. So what we try to do is connect them with the right resources, whether that's residential, whether that's an intensive outpatient program, or whether that's some specialized counseling that they may need.
Right. And all the while communicating with the Family Preservation Court, right?
Yes.
Talking about that recommendation from inpatient and then seeing where they are, no matter where they're living, with more support. And so you guys are a key component to figuring out where the need is, how bad is it, and what is the next step. Did I get that right?
Correct.
Yeah. Well, we appreciate you doing it. I got to tell you, we're so very fortunate to have qualified, specialized clinicians like yourselves making a difference for some people, like you said, Doc, who are not always seen as the ones that are willing or wanting to get the help, but reminding them why they're doing it and what they're doing it for. So thank you for what you're doing from the treatment side. We appreciate it.
Thank you.
And thank you for joining us, for telling us and following with us a little bit about the value and what can really make a difference in a child and a family's life. Family Preservation Court is doing just that. Don't go anywhere. A whole lot more local programming here on HTV.